As a physician assistant, I will be the first to see the patient and retain their baseline vitals to know how to treat my patient. First, I'll introduce myself and explain what I'll be performing on her today and why. The 4 things that we'll be checking on are her blood pressure, her pulse, her lungs, and her heart. I will then ask her pain scale and if she has any questions before beginning the assessment. First, I will start by obtaining my patient's blood pressure, which is a very important part of my patient's health. I will ensure that the blood pressure cuff is an appropriate size for my patient. There's 3 different size cuffs to use on patients: small adult cuff, and large adult cuff. You want to place the cuff over the bare upper arm with the artery mark positioned directly over the brachial artery. The bottom edge of the cuff should be positioned approximately 1 inch above the antecubital fold. I want to see a healthy blood pressure of 120/80. Blood pressure is the force of blood pushing against the wall of the arteries as the heart pumps blood. Anything above 120/80 is considered pre-hypertensive, and if severe is considered hypertensive. Being hypertensive means your blood pressure is high enough to cause damage to your organs. So my patient's blood pressure is 119/70, which for her height and weight is considered normal and healthy. Then I obtain my patient's pulse by identifying where her radial or cordial artery is. We're using her radial, which is on her right wrist. From here, I will count how many beats in a minute, or count how many beats in 15 seconds, and multiply that by 4. The normal resting heart rate for adults ranges from 60 to 100 beats in a minute. I got 86, which is very healthy. As I am checking all of the steps, I will be charting them down on her chart. I will then obtain her lung sounds with my stethoscope and hear if her lungs are clear to oscillation in all fields, meaning her lungs are free of floating liquids, which leads to pneumonia. As I'm checking her lungs from her back, I will have my patient breathe in and out deeply. I would then listen to my patient's heart for any skips or murmurs on her diaphragm. A heart murmur is most often due to acquired heart valve problems. Lastly, I will ask for a urine sample before she leaves to send back to the labs. Urine samples or urinalysis is used to find the cause of or monitor urinary tract infections, bleeding in the urinary system, or kidney or liver diseases. I will then end the doctor's visit and have her be on her way.